The National Health Service, NHS, is the publicly funded healthcare system in the United Kingdom, providing a wide range of medical services to residents, most of which are free at the point of use. Understanding how NHS services work can be key to accessing the appropriate care and support when needed. The system is designed to ensure that everyone in the UK has access to healthcare, regardless of their financial situation. From routine checkups to emergency care, the NHS covers a broad spectrum of services, including general practice, hospital care, dental services, mental health services, and community care. The cornerstone of NHS services is the general practitioner, GP, who acts as the first point of contact for most health concerns. GPs provide primary care, diagnose and treat a wide variety of conditions, and refer patients to specialist services if necessary. Registering with a GP is essential for accessing ongoing medical care, as they maintain your medical records and ensure continuity in your treatment. Once registered, you can make appointments for consultations and routine checkups. GPs also play a significant role in preventive health care, offering services like vaccinations, health screenings, and advice on lifestyle choices to help manage or prevent chronic conditions. Beyond GP services, the NHS operates hospitals across the UK, which provide more specialised care. Hospital services include emergency departments, outpatient clinics, surgeries, and inpatient treatment for more complex conditions. In the event of a medical emergency, the NHS provides free ambulance services, which can be accessed by dialling 999. Emergency care is provided 24 hours a day in hospitals, accident and emergency A&E departments, where individuals can be treated for acute conditions such as severe injuries or sudden illnesses. If the situation is urgent but not life-threatening, NHS 111 is a free telephone service that offers medical advice and can direct you to the appropriate service, whether that be an out-of-hours GP, a pharmacy, or a minor injury unit. NHS hospitals also offer elective treatments, such as surgeries and diagnostic procedures, which are usually accessed following a referral from a GP or specialist. In most cases, treatment in NHS hospitals is free of charge for residents, though there may be waiting times for non-urgent procedures. The NHS aims to provide care based on clinical need, not on the ability to pay, making healthcare more equitable across the population. In addition to physical health services, the NHS also provides comprehensive mental health support. This includes counselling, therapy, psychiatric assessments, and treatment for mental health conditions such as depression, anxiety, and more severe disorders. Mental health services can be accessed through a GP or directly via certain NHS trusts and organisations. Increasingly, the NHS is expanding digital access to mental health services, offering online therapy sessions and telephone consultations, making it easier for people to seek help. The NHS also covers dental care, though unlike other services, NHS dental treatment is not entirely free. There are set charges for different levels of dental treatment, though these are subsidised and are generally more affordable than private dental care. Pregnant women, new mothers, children, and those receiving certain benefits may be entitled to free dental treatment. Dentists working under the NHS offer a range of services from routine checkups and fillings to more complex procedures like extractions and dentures. Patients can choose between NHS and private dental care, though private treatment will typically involve higher costs. Another important aspect of the NHS is its prescription service. While many prescriptions are subject to a standard charge, certain groups, such as those over 60, under 16, or with specific medical conditions, may be exempt from paying. Prescriptions can be collected from pharmacies, where NHS pharmacists can also offer health advice, provide vaccinations such as the flu jab, and help manage minor ailments. For those with long-term conditions requiring multiple prescriptions, a prescription prepayment certificate, PPC, can be purchased to help reduce costs. NHS services also extend to maternity and child health care. Expectant mothers receive free maternity care, including prenatal checkups, scans, and labour and delivery services. After birth, the NHS offers health visitor services, providing support and advice on infant health and development, as well as immunisation programmes for young children. The NHS aims to ensure that all children receive the best possible start in life, with free access to paediatric care and treatments for any childhood illnesses or conditions. Community healthcare is another vital component of the NHS. This encompasses services such as district nursing, health visiting, physiotherapy, and palliative care for individuals with terminal illnesses. These services are designed to provide care in local settings, often in patients' homes, reducing the need for hospital visits. Community care is particularly valuable for elderly or disabled individuals who may struggle to travel to appointments, offering a more accessible form of treatment and support. It is also worth noting that the NHS provides free sexual health services, including contraception, sexually transmitted infection, STI, testing, and pregnancy advice. These services are confidential and can be accessed at sexual health clinics, many GP surgeries, and some pharmacies. The aim is to promote safe sexual practices and offer support to those seeking advice on reproductive health. The NHS is funded primarily through taxation, which ensures that healthcare is available to all, regardless of income. However, there are some services that may incur charges, such as dental care, eye tests, and prescription costs for those not eligible for exemptions. NHS funding is continually evolving to meet the demands of an ageing population, technological advancements, and public health challenges, such as the COVID-19 pandemic, which has highlighted the importance of a robust healthcare system. In summary, the NHS is an invaluable resource for UK residents, providing a broad range of services that cater to both physical and mental health needs. From primary care delivered by GPs to specialised treatments in hospitals, community healthcare, and preventive services, the NHS plays a fundamental role in promoting public health and ensuring access to medical care. Understanding the various services available through the NHS can help individuals make the most of the healthcare system and ensure that they receive the care and support they need at every stage of life.